Hello everyone, welcome back. In this lecture, we will cover the complete anatomy of the heart, one of the most important topic in thorax anatomy and frequently asked in medical entrance examinations, university examinations and viva. At the end of this video, you will understand location and coverings of heart, external features, borders and surfaces, chambers, interior of the atria and ventricles, interatrial septum, heart valves and clinical correlations. Let's begin. Heart is a hollow muscular organ, acts like a body's pump, functions, pumps oxygenated blood to the body, deoxygenated blood to the lungs, maintains blood pressure, supply oxygen and nutrients to tissues. Location, it is in the middle mediastinum between the lungs, behind sternum, above diaphragm, about 2/3 lies to the left of the midline. Size is approximately to the size of a clenched fist. Weight in males 300 grams and in females 250 grams. Coverings of the heart. Heart is enclosed within the pericardium. There are two types, outer fibrous pericardium and inner serous pericardium. Outer fibrous pericardium. It is having tough connective tissue. It prevents overfilling, attached to diaphragm and great vessels. Inner serous pericardium has two layers. Parietal layer which lines the fibrous pericardium. Visceral layer, which is the epicardium, closely covers the heart. Between both the layers lies the pericardial cavity. Contains 15 to 50 ml lubricating fluid. Clinically, pericardial effusion can compress the heart, causing cardiac tamponade. It is external features. Heart has apex, base, borders, surfaces, grooves. Apex, which is the most mobile part of the heart, formed by the left ventricle, directed downward, forward and left, located in the left fifth intercostal space, about 9 cm from the midline. Clinically, it is the site of apex beat. Base faces posteriorly, formed mainly by the left atrium, small contribution from right atrium, receives 4 pulmonary veins. Borders of the heart. Right border formed by the right atrium, left border formed by the left atrium and left auricle, inferior border formed by mainly the right ventricle, small part by left ventricle, superior border both atrias with origins of great vessels. Surfaces of heart. Sternocostal surface, which is the anterior surface. Mainly by right ventricle, also include right atrium, left ventricle and left auricle. Diaphragmatic surface, which is the inferior surface, mostly by left ventricle, partly by right ventricle. Rest on the diaphragm. Right pulmonary surface, formed by right atria. Left pulmonary surface, formed by left ventricle. Next is grooves of the heart. Coronary sulcus, which separates atria from the ventricles. It contains coronary artery, circumflex artery, coronary sinus. Next is anterior interventricular groove. Contains left anterior descending artery, right cardiac vein. Posterior interventricular groove. Contains posterior interventricular artery, middle cardiac vein. Next is chambers of heart. Heart has 4 chambers, right and left atrias and right and left ventricles. Right atrium receives deoxygenated blood. Openings, superior vena cava, inferior vena cava, coronary sinus. Internal features include sinus venerum. Smooth posterior part derives embryologically from sinus venosus. Pectinate muscles present in the anterior rough part which continues into the auricle. Crista terminalis. Vertical muscular ridge which separates smooth and rough parts. Next is left atrium which receives oxygenated blood. Openings 4 pulmonary veins. Interior mostly smooth. Auricle contains pectinate muscles, forms most base of the heart. Right ventricle forms most of the anterior surface. Interior features has 2 parts. Ventricular body, which is the ventricular proper, which is a rough inflow part. Trabeculae carneae, papillary muscles, which is 3, anterior, posterior and septal, connected to valve cusp by chordae tendineae. Chordae tendineae prevents valve prolapse during systole. Next is infundibulum, which is the conus arteriosus, smooth outflow part. It is also having a moderator band, marginal trabeculae, carries right bundle branch, which is an important landmark. Left ventricle, the thickest chamber, wall is 3 times thicker than the right ventricle. Reason is it pumps blood to the systemic circulation. Interior consists of trabeculae carneae, papillary muscles, which is of two anterior and posterior, caudate tendineae. Also aortic vestibule, smooth outflow tract leading to the ascending aorta. Next is interatrial septum. This separates both the atria. Important features include fossa ovalis. In embryology, foramen ovale closes after birth. Failure closes patent foramen ovale. Next is interventricular septum. Separates two ventricles. It is having two parts, the muscular part, large lower portion, and the membranous part, small upper portion. Most common site of ventricular septal defect. Next is heart valves, tricuspid valve, bicuspid valve or mitral valve. Tricuspid valve is between right atrium and right ventricle. Bicuspid valve is between left atria and left ventricle. Pulmonary valve, which is between right ventricle and the pulmonary trunk. Aortic valve, which is between the left ventricle and aorta. Finally, clinical correlations. Patent foramen ovale, that is the persistence of fetal communication. Then ventricular septal defect, mitral valve prolapse, infective endocarditis, cardiac tamponade, valve stenosis, valve regurgitation, etc. That's the complete anatomy of heart, from external features to the internal anatomy of all 4 chambers and valves. If you found this lecture helpful, don't forget to like, share and subscribe Medics Fortune for more simple medicine related learning. Happy learning!